Hello and welcome back to my channel For Dentistry. In this video, we are going to cover all the instruments used in oral surgery and will be asked during your grand VIVA of your final year exam. And trust me, this is the only video you will need to ace your oral surgery practical exam. In this video, we are going to cover maxillary forceps, mandibular forceps, elevators, trauma instrument in details. So watch to the very end. Let's get started. First, we will be identifying different types of maxillary extraction forceps. Parts of a forceps: there are beaks, hinge, and handles. And in maxillary forceps, the handle and beaks are at 180 degrees, that is in a straight line. Let's identify. This is maxillary anterior forceps. They have identical beaks that are closed, straight, flat, and broad. The handles are straight and not curved. They are used for the extraction of maxillary incisors and canines. Next, maxillary premolar forceps. They have identical beaks that are concave on the side facing the operator. The beaks are broad and open. Next, maxillary molars. They are paired instrument, left and right. The beaks of these forceps are not identical. One beak is rounded and the another one is pointed. The pointed beak engages the groove between the buccal roots and the other beak engages the palatal surface above the CJ. How to identify left or right? If the pointed beak is to the left of the operator, it is right-sided forceps, and vice versa. The handles have concavity on the inner side and convexity on the outer side. Next, this is third molar forceps. The handles are extra long and beaks are angulated shaped. This allows us to access difficult to reach areas such as third molar. Next, this is maxillary cow horn forceps. These forceps have unidentical beaks, one of which has a single pointed tip and other a bifid pointed tip, resembling cow's horn. The single pointed tip engages the furcation between the buccal roots and the other tip engages the palatal root. It is also a paired instrument. While viewing, the concave surface of the beaks, the bifid beak, will be on the right of maxillary right-sided forceps and vice versa. Next, root forceps. This is anterior root forceps. They have identical straight, slender, and closed beak. Their long cylinder design provides for ample visibility while the delicate beak securely grasps the root tip. Next, bioniid forceps. They have identical pointed, angulated, and closed beaks. The length of the beaks varies from long to short. Moving on, let's identify different types of mandibular extraction forceps. Their beaks are at 90 degrees to the handles, which facilitate easy access to the mandibular tooth. This is mandibular anterior forceps. They have identical broad, short, and closed beaks. Next, this is mandibular premolar forceps. They have identical broad, open beaks that are longer than the beaks of the anterior forceps. Next, mandibular molar forceps. They have identical broad, stout open beaks with a pointed tip. The sharp pointed tips can engage the bifurcation both at buccal and lingual surfaces. Next, this is third molar forceps. The beak of the instrument is aligned differently. This allows us to access difficult to reach areas such as third molar. This is cow horn forceps. They have identical open, short, and pointed beaks that resemble the cow's horn. The beaks are round and tapered to a point. Remember, there is no left or right forceps in mandibular forceps. Next, this is root forceps. These forceps have identical slender beaks that are closed. The beaks are longer than that of the premolar forceps to enable the forceps to take a deep grip on the root stumps. First, the parts of an elevator. It has blade, shank, and handle. Keep in mind, while using any elevator, the convex part will face the bone and the flat or slightly concave part will always face towards the root or tooth need to be elevated. This is a periosteal elevator. It has two ends. First, broader for reflecting mucoperiosteum, and the second one is pointed for reflecting dental papilla. This is straight Warwick James. The blade is straight. It has two surfaces. One is flat and another one is convex. The flat side is used as a working side. This is curved Warwick James. The blade is straight and at an angle to the shank. It is a paired instrument. Let's identify. The straight or slightly concave part will face the root, so for elevating mesial root of right molar, it goes in the distal socket. So this is right mesial or left distal elevator. It is more clear in this picture. Left one is right mesial or left distal, and the right one is left mesial or right distal. This is a Copeland elevator. It has concave surface on one side that faces the root or tooth to be elevated. It comes in different sizes according to the size of width of the blade. This is a Cryer elevator. It is also a paired instrument. It has a triangular blade. Its working tip is angulated with one convex and another flat surface as usual. The flat surface is working side, so by that logic, this is left mesial or right distal Cryer. In this picture, the upper one is left mesial or right distal. The lower one is right mesial or left distal. This is apex elevator. It is also paired. It resembles to the Cryer but have a biangulated and sharp straight working tip. This is Winter Cryer. It is also a paired instrument. It has a triangular blade. The shank is at right angle to the handle. Its working tip is at an angle to the shank. So these are all the elevators we use generally in our department. The Warwick James, the straight one and curved one, is generally used in maxilla, while other are generally used in the mandible. Now let's discuss the various principles of elevators. There are mainly three principles: lever principle, wedge principle, wheel and axle principle. First, lever principle. It is most commonly used principle. Elevator is lever of first order. Fulcrum is between effort and resistance. In order to get mechanical advantage, effort arm must be longer than resistant arm. It is used to remove roots. Example: straight elevator, Cryer's elevator, apex elevator. Here are some examples. Its mechanical advantage is 3. Second, wedge principle. Wedge is movable inclined plane which overcomes large resistance at right angles to the applied effort. Wedge elevator is forced between the root and the bone parallel to the long axis of the tooth. It is used to remove small root tips. Instrument tip should always be as small as or smaller than the root tip. Excessive force should be avoided. Example: apex elevator, Cryer's elevator. Here are some examples. Its mechanical advantage is 2.5. Third, wheel and axle principle. It is modified form of lever principle. The effort is applied to the circumference of the wheel, which turns the axle so as to raise a weight. Example: crossbar elevators. This elevator can cause fracture of mandible if it is not used properly. Here are some examples. Its mechanical advantage is 4.6. Now moving on to the most important part, identifying different types of trauma instruments used in oral surgery. This is Cheadle's forceps. It is used for picking up sterile instruments from trays and lining from the drums, stored in container containing antiseptic solutions. Next, this is swab holder. It is used to hold swab sponges and scrub or clean the skin or mucosa in the area of operative field, to swab the throat in unconscious patient under general anesthesia, to hold tongue and give anterior traction. Next, this is towel clips. These are two types: pincer types and forceps type. Uses: to hold drapes, stabilize suction tubes, motor cables, tongue, etc. Next, this is Bart Parker blade handle. Next, these are scalpel blade. It comes in different number according to their uses, like number 10 for skin incision, 11 for sharp pointed for stab incision, 12 hooked for mucogingival procedures, 15 for intraoral uses, 20 for skin incision in orthopedic and general surgery, and 22 for skin incision in cardiac and thoracic surgery. Next, this is dissecting scissor. They have long delicate handles and a short blade with cutting edge and striations. Next, this is periosteal elevator. It has pointed end to release dental papilla around the teeth, broad end for elevating the mucoperiosteal flap from the bone. Can be used as soft tissue retractor. Next, this is Howard's periosteal. Next, this is Langenbach retractor. It is used to retract incised edges, to retract soft tissue masses, and it allows visualizations of deeper tissues. Next, this is she-shaped retractor. It is mostly used in abdominal surgeries. Next, this is Austin's retractor. It is short right angle retractor used for retracting cheek, tongue, and mucoperiosteal flap. Its working end is forked. Next, this is Schindler's cat paw retractor. It is used for retracting a small amount of soft tissues. Care should be taken not to apply excessive forces. Next, this is Oxley-Ramus retractor. It is similar to Langenbach except that the edge of the blade is forked, forming V-shaped notch so as to engage the anterior border of ramus of mandible. It is used during sagittal split osteotomy and during coronoidectomy. Next, this is tongue depressor. It is used to depress tongue during endotracheal intubation and extubation, to depress and move it anteriorly to cheek for airway obstruction, to retract the tongue during surgical procedures. Next, this is skin hook. It is used to hold and retract skin edges during cutting, dissecting, and suturing, to retract a small amount of soft tissue. Next, this is suction tip. It is used to maintain a clean field by sucking away blood, flushing solutions, debris, cystic fluid, pus, and secretions. Next, this is needle holder. Its working tip has cross-hatched serration with a single vertical serration to grip the needle. The handle has a catch. Usually a 6-inch needle holder is used. Next, this is curved artery forceps. It is used to achieve hemostasis by catching blood vessels, by crushing, ligating, or cauterizing. It is used to drain an abscess by Hilton's method, as tissue forceps for holding subcutaneous tissue, and aponeurosis. It is used to pick up necrotic tissue, granulation tissue, foreign bodies, bone fragment, etc. Next, Adson's tissue forceps. It is of two types, plain and tooth. Plain or non-tooth, used to hold delicate structure of dissection or suturing. And tooth type to hold the tough structures like skin, coarse muscle, and fascia. Next, this is Babcock's tissue forceps. It is an instrument with broad flared blades with fenestrations and without teeth, more delicate and less traumatic than Alice's forceps. It is used to hold enlarged lymph nodes or any glandular tissue or appendix. Next, this is bone ronger. This forceps has curved handles with spring actions. The tip of the blade is angulated forward towards the handle and has a concave inner surface. The beaks are sharp. Next, this is bone cutter. Shape of the blade is different and have a side cutting action only. It is used to cut sharp bony margins following surgical procedures. Next, these are chisels. They have a heavy round square handle and a long flat working tip. These are mainly uni-beveled. It is used to smoothen the bone. Bevel is kept facing the bone, whereas to cut the bone, it is kept facing away from the bone. Next, this is pterygoid osteotome. It is similar to chisel but bibeveled. It splits bone rather than cutting or chipping it. It is designed in completing osteotomy between the maxillary tuberosity and pterygoid plates in Lefort 1 osteotomy procedures. It has curved end. It is placed between tuberosity and pterygoid plates of sphenoid bone. Next, this is mallet. It is similar to hammer, made up of steel, lead or wood. It is used for giving control taps on the chisel or osteotome. To be effective, the mallet should be used with loose, free swinging movements of the wrist. Next, this is handpiece. It is a quicker method of bone removal. The handpiece should have relatively high speed, 35 to 40,000 rpm, and torque which allow rapid bone removal. Next, these are burrs. Stainless steel carbide and available in different shape and length. Next, this is curette. It is an exploratory instrument with a spoon-shaped working tip used to scrape soft tissues from bony defects. The working end may be in the plane as the shank or at right angulation for adequate access to enucleate cyst, granulomas, intraosseous tumors, cystic neoplasm. Next, Huyton-Williams forceps. It has two widely divergent curved beaks that engage the maxilla behind the tuberosity. It is used for mid-palatal fractures. Next, this is Rose maxillary disimpaction forceps. It is a pair instrument and used for disimpacting maxilla in Lefort fractures. It consists of a straight unpadded blade and curved padded blade. The unpadded blade is passed upon the nostril and padded blade grip the palate. The operator stands behind the patient and manipulates the fragment into the position. Next, this is Ashen nasal septum forceps. It is used to reduce and align fracture of the nasal septum. Blades are passed on either side of the septum and vomer and perpendicular plate of the ethmoid bone. Next, this is Walsham's nasal bone forceps. It is used for reduction of nasal fractures. It has two blades. Small blade is inserted into the nose and the larger is applied externally to grip the side of the nose up to the medial canthus and parallel to the frontal process of maxilla. Next, this is Bristow's elevator. It is a flat instrument of sufficient rigidity and it is inserted into the same plane to reduce zygomatic arch fractures. Next, this is Rowe's modification of Bristow elevator. The instrument has blade and an oval handle similar to Bristow's pattern as well as lifting handle, which is attached by a strong hinge with a positive stop near the origin of the other handle. Next, this is Stacy zygomatic hook. It is used in zygomatic fractures. Next, this is Smith spreader. It has three blades that are separated by spring action when the handles are compressed. It is used to separate bony fragments after completion of the osteotomic cuts, mainly used to check separation of fragment during downward fracture of maxilla. Next, this is bone awl. Long slender instrument provided with an eyelet at tip through which the wires are pushed in for transosseous wiring. It is used for placement of circummandibular wiring or can be passed around the zygomatic arch or piriform as in maxillary suspension procedures. Next, this is Hister's jaw stretcher. It is used in trismus due to infection, muscle spasm or hemarthritis of TMJ following surgery. Post-operative active jaw physiotherapy after TMJ ankylosis or OSMF. Next, this is Ferguson mouth prop. It has similar function as of Hister's jaw stretcher. So guys, this video completed all the instruments used in oral surgery which can be asked during VIVA for identification and how to use them. Kindly go through this video 1 or 2 times to completely understand. If you like our video, kindly subscribe to our channel, which will motivate us to bring more informative video in the future. Thank you for watching For Dentistry.